And how have your clients been taking to it? As you say, some are, will embrace it. Some will be a little hesitant. But overall, what's been their overall experience of they actually have they enjoyed doing the program? Do they have resistances to it?
I would say that the overwhelming vast majority, 80% or more, love it because it helps them and it changes their life. And I mean, quite honestly, I wouldn't be here talking to you if I didn't see that type of response in my patients. I'm very particular about what I ask my patients to do. And I'm very particular about trying to avoid the nonsense that a lot of doctors throw at patients. And if I'm going to ask a patient to invest their money, several $100s and months of their time, I need to be absolutely convinced it's going to work. And I have that explicit trust with your program. I've done it myself. I've seen it change my patients. And these are patients, remember, they're not just patients who've got some bloating after they eat. They're typically patients who've been ill for 2 decades or more. They have symptoms in every area of their body. Some of them can barely get out of bed to function throughout the day. Many of them are on medical leave. Some people are so sick from mold and environmental toxicities, they live in a tent. They live in their car. Some patients come in with 3 foods, right? And so a lot of these patients are so extremely vulnerable and sensitive that if I tell them to do 3 things and I'm asking them to do something that's unattainable, I'll never see them again. And they're going to continue to suffer. So I have to be very careful about what I ask patients to do and when. And time again, the Gupta program has really helped shift these patients to where I can start to heal them. So from that standpoint, it's extremely helpful. And so thank you. It makes my life easier and it helps my patients.
And finally, any advice for, I suppose the practitioners, the people who are seeing these clients again and again? They might be functional integrative doctors, alternative practitioners, naturopaths, who are a bit kind of cautious about this type of approach. Anything you'd like to share with them?
I would say it's not just my experience that this is helpful. It's not just me personally, and it's not just my patients, right? It'd be very easy for me to placebo my patients into something working. Hey, Johnny, you got to do the Gupta program. It's the only thing that'll help you, blah, blah, blah. And they say, oh, okay, all right. And they get a little bit of a response and then maybe it fades away. That doesn't happen. Patients do the program and are profoundly changed and are able to take treatments that they were not able to take before. And oftentimes they've been sick for a decade. So I think that there's a level of clinical evidence that it works, but it's not just my patients. Dr. Ruscio uses it. His patients benefit, right? Dr. Abbott in our clinic, Dr. Hamlin, they are all using this. It's all working. And not just our clinic, right? We've got Dr. Nathan consistently uses this with his patients and on and on. So this is a reproducible effect, if you will. And I know that you guys are contributing to research. And I know you're excited about showing that this works, and time is going to show. I just have no doubt that you're going to have multiple papers published showing that it helps. And any practitioner with any skepticism or hesitation, try it. It works. You'll be surprised.
Wow, thank you so much, Joe, for that. That's really kind of encouraging, because certainly we have continual conversations with various organizations and practices, and it's great to have someone like yourself kind of sharing their experiences, and it really makes a difference.
Good.